Intramuscular injections deliver medicine directly into your muscles. This method ensures that the medication is absorbed quickly and efficiently, making it a preferred choice for many treatments. It's like a shortcut into your bloodstream. The medicine bypasses the slower absorption process of oral medications, providing faster relief or action. This quick absorption makes it perfect for vaccines or certain medications that need to act fast. For instance, vaccines often use this method to ensure a swift immune response. Think of it like this. When you get a shot in the arm, it's likely an intramuscular injection. This is because the arm muscles are easily accessible and can absorb the medication efficiently. These injections are typically given by a healthcare professional. They are trained to ensure the injection is administered safely and effectively. However, with proper instruction and practice, self-administration or administration by a trained caregiver can be possible. This can be particularly useful for patients who require regular injections. Always remember, safety is paramount. Proper technique and hygiene are crucial to prevent infections or complications. Never attempt an injection without proper training and guidance from a qualified healthcare provider. They can provide the necessary instructions and support to ensure the process is done correctly. Before we begin, let's gather our supplies. It's crucial to have everything you need within reach to ensure a smooth and safe injection process. You will need the prescribed medication in a vial or ampule. Make sure to double-check the label to confirm it's the correct medication and dosage. A sterile syringe and needle are essential. The size of the needle depends on the type of medication and the patient's needs. Always use a new sterile needle and syringe for each injection. You will also need alcohol swabs to disinfect the area, a small gauze pad to apply pressure after the injection, and a puncture-resistant sharps container for safe needle disposal. Proper disposal of needles is critical to prevent injury and contamination. Once you've assembled your equipment, wash your hands thoroughly with soap and water. Hand hygiene is a vital step to prevent infection. Make sure to scrub all parts of your hands, including between your fingers and under your nails. Now, let's prepare the injection. This involves several steps to ensure the medication is administered correctly and safely. Clean the top of the medication vial with an alcohol swab. This step is crucial to remove any potential contaminants that could be introduced into the vial. Then, draw air into the syringe, equal to the amount of medication you'll be withdrawing. This helps to balance the pressure inside the vial, making it easier to draw out the medication. Inject this air into the vial. This makes withdrawing the medicine easier. By doing this, you ensure that the medication flows smoothly into the syringe without creating a vacuum. First, locate the injection site. This is crucial for ensuring the injection is both safe and effective. Divide one buttock into 4 quadrants. This helps in identifying the safest area for the injection. The upper outer quadrant is the safest and generally most comfortable. This area minimizes the risk of hitting major nerves or blood vessels. Clean the injection site with an alcohol swab in a circular motion, working from the center outwards. This helps to reduce the risk of infection. Allow it to air dry. This ensures that the alcohol has enough time to kill any bacteria on the skin. Remove the needle cap and hold the syringe like a dart. This grip provides better control during the injection. With a quick, firm motion, insert the needle at a 90-degree angle. This angle ensures the medication is delivered into the muscle. Pull back slightly on the plunger. This step is to check if you've hit a blood vessel. If you see blood, you may have hit a blood vessel. Withdraw slightly and try again. It's important to avoid injecting directly into a blood vessel. If no blood appears, slowly inject the medication. Take your time to ensure the medication is administered properly. Once the medication is fully administered, swiftly withdraw the needle at the same angle. This helps to minimize discomfort and tissue damage. Apply gentle pressure to the injection site with a clean gauze pad. This helps to stop any minor bleeding and promotes healing. Section 4. Why the buttocks? The buttocks are a prime location for intramuscular injections because they offer a thick muscle mass with fewer major nerves and blood vessels nearby. This makes it a safer and often less painful area for the injection. However, choosing the correct site within the buttocks is crucial to avoid complications. Remember, the upper outer quadrant is your target. Always consult your healthcare provider if you have questions about site selection. Section 5. After the injection, what to expect. After the injection, you might experience some mild side effects like soreness, redness, or swelling at the injection site. These are normal reactions and usually subside within a day or two. Applying a warm compress to the area can help. Avoid massaging the injection site, as this can spread the medication and potentially cause irritation. If you experience any unusual or severe side effects, such as increasing pain, fever, or signs of an allergic reaction, contact your doctor immediately.